All right, welcome everybody. Thank you so much for coming to our breast cancer awareness class. We're going to introduce Amy Peterson. She is with the Sentara OBC Cancer Center. She's the community education coordinator. Amy's done quite a few presentations for us, so we're happy to have her back doing this. And thank you all for coming, and I'll let her take it away.
All right, thank you very much. Thank you guys for coming. As she said, I am Amy Peterson, and I am the community health educator for Sentara OBC Hospital and also the Sentara Cancer Network. I want to share with you guys one of my favorite quotes. It's from Elizabeth Edwards, and she said, "She stood in the storm, and when the wind did not blow her way, she adjusted her sails." As women, we tend to plan out our life. I'm going to do this, 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 and this. And nowhere in your plan do you say, I'm going to get breast cancer. That's nowhere in our plan. Instead, if that happens, you're going to have to adjust your sail. You're going to have to make some changes in your life. If you know someone that is going through their own storm and having to adjust their own sail, I have some suggestions for you. Be sincere and actively listen. Now, what is actively listening? A lot of people, when they're having a conversation or they're listening, they tend to interrupt people and they start talking about their own story. Instead, just sit back and just listen. A dear friend of mine yesterday, she just told me that when her sister was going through breast cancer, the best time was just her and her sister just sitting there, not talking, just sitting there being together. Another thing is to offer to babysit or pet sit. That is a really big deal because I know I have a little white dog, beautiful little white dog who will not go out to the outside without being walked. So if anything were to happen to me, I would be so grateful for someone to just come over and walk my dog. But it's little things like that that you can do that would help somebody who is going through cancer treatment. Another thing is to provide rides. A lot of people have family members that are willing to come and help them give rides, but they still have to work. Have you guys ever heard of the American Cancer Society's Road to Recovery? I'm going to leave some little brochures here. They are actively looking for people to volunteer for Road for Recovery. What that is, it's through the American Cancer Society, and people volunteer to give people rides to chemotherapy. During the chemo process, people get tired. It's not best for them to drive themselves. Somebody needs to drive them. So if you have just a little bit extra time, please consider donating some time to Road to Recovery. Another thing is to visit and keep things as normal as possible. Don't be scared to go visit someone. They need your support. And like I said, just go, even if you're just going to go sit, just be with them and let them know that you care about them. So what is cancer? Cancer is a disease where one cell divides and starts taking over the healthy cells nearby. Do you guys remember Pac-Man? Mm-hmm. Thank you. I'm glad you're old enough to remember that. So think of cancer like Pac-Man. Pac-Man is the cancer, and do you remember Pac-Man had to eat all the dots? Those little dots are the healthy cells that are all around it. And then do you guys remember that there were some ghosts that used to come and they used to destroy Pac-Man? Those are called chemotherapy and radiation. So for me, I like visual things. So that's just an easy way for me to remember what cancer is. According to the American Cancer Society, as of right this moment, there is no known cause of cancer, but we do know that there are certain things that are going to put you at a higher risk factor. One of those is being female. 1 in 8 women will get some form of breast cancer in their lifetime. For men, 1 in 1,000 men will get breast cancer. Yes, men can get breast cancer. Now you stop and think that, 1 in 1,000, that's really not a lot. But if you break that down, how many men do you pass a week? You're driving your car. You're walking through Walmart, you're at work, you see men. I bet you if you really stopped and thought about it, you pass 1,000 men in a week, easily. 1 in 1,000 men. So men do need to think about it too. And as women, encourage our men to think about breast cancer also. Getting older. Most newly diagnosed cancer patients are over the age of 60. I was recently doing some research. Do you guys know what the youngest breast cancer patient is? How old she was? She said 15 or 16. Anyone else know?
Maybe 14.
3.
What?
And that was as of 2011, and I pray that there isn't anyone younger.
Oh, my Lord.
But the youngest was 3 years old. So although most people are over the age of 60, it can happen at almost any age. So we all need to be thinking about it. Another factor if you might get breast cancer is your genetic disposition. If you have a first-degree relative who has had breast cancer, your chances are higher that you're going to get it. A first-degree relative is a mother, a sister, a daughter. If you've had a first-degree relative that has had it more than once, your chances are even higher. If you have a first-degree relative on either your mother's or your father's side who has had breast cancer and ovarian cancer, your chances are even higher. Now, not every breast cancer is inherited. And just because you've had a family member that had it does not mean that you are absolutely going to get it. What that means is that you need to talk with your doctor and let him know your family history. Another risk factor is race. Caucasian women get it more often than any other race. Not exactly sure why that is, but Caucasian get it more often. That does not mean other races do not get that, so everyone needs to be aware. Dense breast tissue. That is when a woman's breast has more glandular tissue and less fatty tissue. And if you have dense breasts, your doctor will most likely tell you. And it's harder to see if you have a mammogram and you have dense breasts. It's harder to see any kind of lump. There's now a 3D mammogram. And the 3D mammogram does detect 35% more breast cancer. So it's highly encouraged. Any woman that has dense breasts to please consider getting a 3D mammogram when you get your next mammogram. And your menstrual cycle, that's another factor. The earlier a girl starts her menstrual cycle and the later she goes into menopause increases her risk of breast cancer. That's the length of time a woman will have the estrogen in her body. So that's some factors, and I do help out at my son's school occasionally. He's in 5th grade, and I see some of those girls, and I just hope for their future, that it doesn't happen to them. But 4th and 5th graders now are going through puberty. I want everyone to read this. Just take a minute and read this slide. 38% of all breast cancer cases could have been prevented. That's more than 1 in 3. Could have been prevented. That means there are things we're doing wrong, myself included, that we are all doing wrong that increases our risk. The things that I just talked about, our age, our genetics, we have no control over that. But I'm going to give you guys some suggestions on some things that you can control that'll help lower your risk of getting breast cancer. Maintain a healthy weight. The American Cancer Society right now is doing a CPS-3 study, and they are determining if weight has a factor with cancer. Studies are already showing that the heavier a woman is, the more likely she is to get cancer. Along with that, if you have cancer and it comes back, you are at a higher risk of not surviving that cancer if you are obese. So all of us need to control our weight. Breastfeeding your baby. Now, I know that's not for everybody, but if a woman does breastfeed her child, it does help cycle the hormones through her body a little bit faster. But again, I know it's not for everybody, and just because you don't choose to breastfeed does not mean you're not going, that if you choose not to breastfeed, it doesn't mean you're going to get cancer. But if it's something you can do, please, I encourage you to breastfeed your child. Alcohol consumption. Studies have proven that the more a woman drinks, the more likely she is to get breast cancer. Now, I'm sure you've heard one drink's good for the body. I will absolutely agree with that. I'll admit the weather's getting a little colder, and I'm not a big drinker, but if I get really cold, I will have a glass of wine because for some reason it warms up my toes. I can't explain that. But one glass is okay, but one glass. Another thing women should do to help reduce their risk of breast cancer is exercising, walking. Very important to get some form of exercise every single day. The recommended is 30 minutes a day. As a woman walks, she is releasing estrogen from her body. So that's a good incentive. And it doesn't matter. I know today is not a good day to walk. It's raining outside and it's cold. But treadmill, that's okay. You can take the steps instead of taking the elevator. When you're at the grocery store or department store, park way out and walk up. Every little bit of exercise is good, but try to exercise 30 minutes a day, at least 5 days a week. Red and processed meats have been linked to increased risk of not just breast cancer, but all cancers. Processed meat, those are bologna and hot dogs, things like that that are not pure meat. Again, I'm not saying you cannot eat these things. Instead, I'm saying everything in moderation. Every now and then, to have a plate with, you know, that big old steak on one half of your plate and that baked potato on the other half, that's okay. But everything in moderation. High consumption of fruits and vegetables will reduce your overall risk of cancer by 15%. Have you guys seen the food plate, the recommended food plate? It used to be a food pyramid, and now it's a food plate. On that, it tells us our fruits, our vegetables, how many servings every day that we should be getting. If we all just did that, we would reduce our overall cancer rate by 15%. That seems really easy, and I know it's not. I like some of the drive-thrus around here too. But try to make a smoothie. There are other ways to get your fruits and vegetables in. 15% just by doing what we've already all heard. Now, what is your breast cancer risk? I brought these cards for everybody. I have them over here on the side. Know your risk. The Sentara Cancer Network has come up with this wonderful Know Your Risk website. And what you can do is you can go online and you'll take this little assessment of your personal history. And it's going to give you some indication on if you may or may not get cancer. Then you can go ahead and give that printed out, give it to your doctor. Now, if it does come back and say that you have a high probability based on the questions, don't freak out. Doesn't mean that you're absolutely going to get breast cancer. It's just saying you need to be aware and you need to talk with your doctor. They also have other ones for prostate cancer, for lung cancer, for colon cancer. So Sentara, Know Your Risk. It's a wonderful website that's going to help educate you. Breast cancer screenings. There are things that every woman should do to help reduce your risk of breast cancer. Every woman over the age of 20 should be doing self-exams. Now, I don't know if you guys remember, it used to say you had to lay a certain way at a certain time of the month and do it a certain way. That is no longer what they're saying. Instead, it's your body. Look, feel. If you want to do it in the shower, she's passing out some cards on suggestions on how to do it in the shower. It's your body. Look, you don't have to wait till a specific day of the month. You can do it anytime. Clinical breast exams. That is when a doctor or a nurse practitioner or a certified breast examiner will take his or her hands and they will feel for any lumps in your breasts. It's recommended for women between the ages of 20 and 40 to get one every 3 years. But for a woman, once she hits the age of 40, a woman should be getting a clinical exam and a mammogram every single year. A mammogram is the easiest, best way to detect the earliest forms of breast cancer. Now, a lot of people get really scared when they hear the word cancer, and I would be too. I will admit that. It's really scary. But I want to show you guys some hope. This study from the American Cancer Society just came out last month, and what they have found is that if a woman finds breast cancer in stage 0 or 1, her survivability rate is 100% in the first 5 years. The only way to be part of that 100% is to find it in stage 0 and stage 1. Early detection. That's encouraging. Do any of you guys know anyone that has survived breast cancer? It is survivable now. We don't want to hear the words that we have breast cancer, but keep hope. It is survivable.
Amy,
Yes, ma'am.
did they say 100% 5-year survivability rate? Is that because that's the length of time they look at in terms of if you've made it past them, then you're in the clear?
Yes.
Okay.
You're not necessarily in the clear.
Well, better, yeah.
Yes,
Yeah.
yes, your chances are better.
Okay.
Yes. But that's very encouraging. 100%. That's something that we need to keep in mind. At Sentara OBC Hospital, we do have a wonderful Pink Passion support group. It meets the first Wednesday of each month at noon at the hospital. If you know anyone that is going through breast cancer, encourage them to please attend a support group, because I've been trained to facilitate these meetings. I do have a medical background, but I thank God that I've never had breast cancer. The experts on breast cancer are the women that have survived it, the women that have gone through chemo. They know what it feels like. If we haven't gone through it, we do not know. So the experts in the cancer field are the survivors. The support groups are just a great way to come together, to support each other, and to just be with other people that have gone through exactly what you're going through. So please encourage women to come to a support group. Have any of you guys heard of the Look Good, Feel Better program? That is through the American Cancer Society, and it is hosted at Sentara OBC Hospital. We do it once a month. We bring in women who are currently going through cancer treatment, and we give them suggestions on where they can get wigs, how to tie scarves. We give them a makeup kit that is worth, at a minimum, $200. It's been donated by some of the best companies. We teach these women how to put on their makeup, because as a woman goes through chemo, her skin changes. Her skin gets dry, things like that. So we teach them, it's exactly as it says. Look good, feel better. Now, you would think that losing your hair would be the most traumatic for a woman going through chemo. Nowadays, what I have found, it's not the loss of their hair, it's the loss of their eyebrows. There are some wigs out there that women wear that are amazing, and you can't even tell they're wigs anymore. Wigs have come a long way. But it's hard to cover up the loss of your eyebrows. It's hard to cover up the loss of your eyelashes. So the Look Good, Feel Better program teaches women how to put those on. As a special little bonus here in Suffolk, the facilitator that we have for Look Good, Feel Better, she is a native from Suffolk. She's lived here her whole life. It was really inspiring to me when we had a meeting, it was a couple months ago. She knew every woman in the room. Every woman knew her. That just made it a family atmosphere. They were able to really share and go through the same things together. So I encourage you, anybody that you know that is going through cancer treatment, they do not have to be a patient at any Sentara hospital. They can come from anywhere. The only requirement I have for Look Good, Feel Better is that they call and make an appointment. I have to make sure that I have a makeup kit available to them. Now, I'm going to leave you guys with a true story. I have a friend, and when she was 43, she was diagnosed with breast cancer. At that time, she had 3 kids. They aged from 12 to 8. They were all boys. So you can about imagine what her life was like. She was running around. She had a busy life. When she was told she had breast cancer, I'm going to quote her. She said, "I ain't got time for this." Rightfully so. That's understandable. What happened is a couple days later, she was in bed and she couldn't get back out of bed. The reality of breast cancer hit her, and she couldn't even get out of bed. But what she did, she adjusted her sail. She changed her way of thinking. She got out of bed. She had a double mastectomy. She accepted the help of her neighbors, her friends. She let people take her kids to soccer. Soccer was big for her boys. It was okay for her to accept the help, and it was awesome that people offered the help. But she had to adjust her plan. She never planned to have breast cancer. None of us do. But you have to adjust your sail. I'm so proud of her because as a busy mom, she took the time to get her mammogram. She took the time that she needed to recover, to get the cancer out of her body, to go through the surgery and the recovery. I'm just so proud of her for doing that, and I encourage each and every one of you that you're important enough to take the time to get early detection, get the tests, get your mammogram, do your self-exams. You're worth it. And for your family, please take the time and do it. Thank you guys for listening to me.